Okay, good afternoon, everyone. Thank you all for joining us this afternoon. Uh, in terms of continuing with this CaTS COVID-19 Chronicle seminar series, this particular series focuses on community engagement and research addressing COVID-19. We have a very dynamic and wonderful panel today, but before we get into introducing the panelists and then getting into the meat of our discussion this afternoon, I want to just first welcome everyone of you, and we appreciate you taking time out of your busy schedule. We want to encourage you to ask questions because we want this to be very dynamic in nature and very organic in terms of the discussion that flows. We want to answer questions that you may have, so please put that in the chat box. But this series, like we said earlier, is being sponsored by CaTS, which is Louisiana Clinical and Translational Science Network Center. And basically has been working on addressing COVID-19. Researchers around the state working with community organizations, collaborating among each other in trying to address COVID-19. So as of October, we started this series as a way of educating ourselves and the community about what is going on and what we're doing in Louisiana to address COVID-19. There's been a number of these seminar series focusing or featuring scientists and clinicians and showcasing their work and what they're doing. So please stay tuned with additional seminar series that are going to follow in months to come. So if you're on the listserv, you should be getting this information, and we hope that you'll be able to participate in future events also. Like we said earlier, please ask questions. We'll make sure that we address them. We have two co-moderators, Ms. Fields and Ms. Megan, who are going to assist me in moderating this session. So without further ado, we'll go ahead and introduce our dynamic and wonderful panelists who come from three different perspectives as it relates to engagement with the community. And they're basically going to touch on various aspects of it, whether it's a nonprofit space, working with the Latino, Hispanic community, other diverse populations, whether it's in the space of funding or both in the academic and in the policy area. So I'd like to first start off by introducing Miss Kristina Gustavson. I know I'm messing up on her last name. She's with the Shreveport CAP. She's the Chief Executive Officer of the Community Foundation of North Louisiana. Next is Miss Mariana Montero, who is the founder and executive director of Golden Chain Inc., which is a nonprofit organization in the greater New Orleans area. And then we have Dr. Sandra Brown, who is the Dean of Southern University's College of Nursing and Allied Health, and also serves as a co-chair of the Louisiana COVID-19 Health Equity Task Force. Ladies and gentlemen, this is our panelists. We believe that they're going to bring some great insights as it relates to community and research and how we as a state addressing or fighting COVID-19. So to start us off with, we're going to ask each of the panelists, and it's not going to be any order, but as they see fit, they can begin to describe and discuss what communities are they working with or serving, and in what ways have their organization or themselves worked to actively engage their community and also support their community to navigate this terrain in terms of COVID-19. So this is the question at hand, and would ask whoever wants to go first can take that question to tell us a little bit about the community that they're serving and the things that they're doing in addressing COVID-19.
I'll take it.
Yeah.
Hi, my name is Kristina Gustavson. I'm the CEO of the Community Foundation here in Shreveport, Community Foundation of North Louisiana. We serve all of North Louisiana, but we primarily, or we focus a lot of our service on Caddo and Bossier parishes, so Shreveport and Bossier City, and then the rural areas surrounding, and also do a lot of work in the Lincoln Parish or Ruston area. So we have sort of several different buckets of people that we serve. The first service bucket would be the nonprofits that we actually provide funding for. And we engage with them as a way of getting a global picture of what's going on in the community. You know, we can't touch all the clients that they touch on a daily basis, but in our engagement with them, we get a big overview of what the needs are of the community. We also obviously serve our donors in trying to make sure that they are able to achieve what they want to achieve through their philanthropic dollars. And then we act as a convener and community partner with both the private sector and the public sector. So if there's a problem or an issue that we think needs to be addressed, but needs to be a multi-sector approach, then we sort of try to pull all those players together and get everybody to start talking. So that's sort of the role that we play normally, and the role that we played on steroids during coronavirus. So.
Thank you, Ms. Christine, for sharing that with us. And
I'll go next. I'm Sandra Brown. I serve as the Dean of the College of Nursing and Allied Health at Southern University. Southern University is one of the largest HBCUs in the nation, and we play a critical role in educating minority students. HBCUs are even more paramount now in light of COVID-19 as a trusted source of information. And so in that light, the School of Nursing has been actively engaging in offering community awareness and educational platforms to particularly underserved populations. We have just launched what's called a Black Health Series, and that's in partnership with our Southern University Foundation. It is a virtually based educational series that we piloted this semester with our community individuals who live in the surrounding communities. And we covered three main topics: diabetes, hypertension, and stress. And we had a wonderful turnout. It was very engaging, and we are going to do some focus groups with the participants to learn more about grassroots levels of what was important for them to learn during these series and future topics. Our mission is rooted in serving vulnerable populations, and our focus has been education, practice, and research, primarily focusing on health disparities.
Ms. Mariana, you want to pick up?
Okay, I am Mariana Montero again. I represent the organization Evolving Change, which is to empower, the mission is to empower the diversity community. We concentrate more with the Hispanic community. How we have been involved with the community, we did a partnership. This was like really created as the COVID-19. We get together with the Center of Minorities from Xavier University, the Center for Minority Health and Health Disparity Research and Education from Xavier University. And we start this pilot project. They call COVID-19 was an effort for the Latino community and was created to assist those who require balancing and managing their emotional and physical health. The project was broadcasted through social platforms such as TV Nola, Jambalaya News, and Facebook. These were like 4 different episodes. We use this as a program, Encuentro y Conversación, which say in English, encounter and conversation. And we have these topics like balancing life during the COVID-19, or how to manage change during this difficult time. And also we did other roundtable with a roundtable talking with different representatives from the city. And the wonderful thing of this is everything was in Spanish to really bring this information to the community. Also, Golden Chain has been involved with the regional crew of Louisiana, all of us, and we have programs that also we did the first town hall meeting, giving information about the resource, how to really get involved, and how the community, Hispanic community can get involved in resource, and how can be part of this effort, like really for a better future and health. And this is what we are trying to do in Spanish. And also, we have been involved with the Promotion Advisory Council, where they really get all the information in Spanish to reach and encourage the Hispanic in Louisiana and update it and share information about the COVID-19 and also what else they are offering in the health area. We are very active working with the Hispanic Apostolate, which is an entity for the Hispanic community here. We are really actively engaged also as an ambassador with the Department of Health, giving all this information, providing in Spanish to our community.
Well, thank you all so much for the introductory comments. I think you all raised some very critical issues. So we're going to dive in a little bit more. I think there's excitement about funding for community organizations. So I want to drill down a little bit on that because in many ways, a lot of small community organizations do have a hard time competing for funds. So in what way is these all the funding structured so that at least the community organizations who are really boots on the ground can get the funding to do the kind of work? So could you expound a little bit on that in terms of what your foundation is doing in Northern Louisiana? And is it only limited to Northern Louisiana, or the funding goes across the state?
So normally we do a competitive grant process that's limited to Caddo and Bossier Parish. This year, shortly after the shutdown in the state, we started the COVID-19 Emergency Fund. And the purpose of that fund was to provide nonprofit organizations funding that they needed in their response to the coronavirus pandemic. So one thing that was really clear to us really quickly is how, while a lot of for-profit businesses were closed, not only were the nonprofit organizations that we support generally not closing, but there was a large uptick in their clientele because of the needs, as well as there was a large uptick in their expenses because they had to sort of change their model of delivery overnight. And so since the inception of that COVID-19 emergency fund, we've given out over $150,000 in grants just for expenses that relate to COVID-19. In addition to, we've done almost $3 million in competitive grants this year. Those also were limited to Caddo and Bossier Parish. And we have, we're going to make an announcement this week that we are actually doing a grant to LSU HSC in the amount of $10,000 for their wastewater auto sampling testing. So they are testing wastewater here in Caddo and Bossier for coronavirus to see where they can focus their coronavirus outreach, as well as testing more on a neighborhood by neighborhood basis rather than sort of trying to tackle it on a citywide basis. And the professor that applied for that grant, just so I can give him a shout out, is Kevin Murnane. He's the associate professor of the Department of Pharmacology. And so a lot of the nonprofits that we supported, just to give you an idea, in the healthcare space, we made a grant to the Martin Luther King Health Center and Pharmacy for $10,000 for extra pharmacy expenses. They wanted to be able to bring the folks that they serve, which are an underserved population, in and have them go away with more than their normal 30, 60 days of pharmacy supplies. So that enabled them to do that. St. Luke's Episcopal Mobile Medical Ministry went out and worked with the homeless population in their mobile medical unit. Caddo Council on Aging, doing their, Meals on Wheels program for the elderly, so the elderly didn't have to get out of their homes. The David Raines Community Health Center here had a program that they wanted to translate into Spanish and called Ayuda Corona, and we supported them in that. We had the Life Share Blood Center asked us for funding for a convalescent plasma program for COVID-19 patients. So that's just a little sort of snippet of some of the grants that we gave. But we were, the grant process was really quick rather than our normal two-stage grant process for competitive grants. We wanted to move really quickly and get funding out the door as quickly as we could because we knew, this was an emergency situation. So we moved expeditiously and with more flexibility than we are able to in our normal competitive grant process. So, and we're still considering a couple more applications, but we're hoping that we're going to utilize all of that funding by year end that we collected for COVID-19. So.
Thank you so much.
And I should say we fund only 501c3 organizations.
Dr. Brown, you talked about Southern's initiative, which sort of maybe was a spin-off from the activities with COVID-19. So what has been some of the things that you all are learning about community needs? And it could touch on COVID, but it could again go beyond COVID, because we know that some of the health disparities that exist in our communities is what is driving some of the COVID cases and mortality.
Absolutely. The Black Health Series was a spinoff of some of our community outreach stakeholders subcommittee response to that by offering a means to empower our community to learn more about, those health disparities. If we're going to move the mark for Louisiana, we rank 49th, then what we feel is we have to move from a macro to a micro level. There are some pockets, there are some parishes that are driving our health rankings so low. And so it's imperative that we do some boots on the ground, grassroots level inquiry into exactly what's happening in those areas. Forming academic practice partnerships has worked for us. We have the academic end, and so we've been partnering with local agencies, hospitals, Our Lady of the Lake, Ochsner, just, to name a few, to do some grassroots level looking at shared resources of what we can do to explore, health disparities a little bit deeper. Through the COVID-19 Health Equity Task Force, as you are aware, we funded the prevalence study. And so that generated some early data on the prevalence of COVID. And we've also funded smaller grants. The LSU Manship is looking at communication and messaging. So just trying to do a broad sweep across the state and then take a deeper dive looking at more local community activities that we can really target our interventions and tailor them.
Okay, Miss Mariana, with the golden chain, I know, what would you say would be some of the lessons learned from the activities that you did within the Latinx Hispanic community?
What we as a Golden Change is a nonprofit organization and has been involved in with so many other organizations. We can see the impact that really this is getting to the community, and the response is so positive because we have a lot of Hispanics now involved in what is this information for the research or for the engagement with the nonprofit, with Golden Change. But what is the positive thing that I see is that really Latinos are more involved now and also participating in all these researches that exist. That is a positive way with your question was with all the events that we have during the COVID-19,
Right.
that we did. For example, the one we did with the Central Minorities for Health and Disparity was very acceptable because it was more concentrated with the mental health, and in this difficult time, uncertain time that is with the Latinos, was a very positive, the information that we provide in Spanish, because that was not available before. And now, with these efforts, we could do it in Spanish. That was a good thing for the community. And also, with all the services that we have been offering through other organizations, not only because of the language, but also the cultural sensitive, that the most information is provided now to the Latino community. It's a wonderful thing for them. And I am, as a Hispanic, and as a representative of Golden Change, we feel very proud that we could really educate our community.
So, and this question goes to all the panelists, and whoever wants to go first is fine. So how have your community members responded to COVID-19 research and engagement? And what insights can you provide? And, whether it's the funding, whether it's the Black Health Series, or other events that you've done, or just pushing for the various communities that you serve, their engagement more in research.
Well, I'll take a dive at it. There is an earned mistrust of research engagement among African Americans. And it's not that they don't trust the science, they don't trust the scientists. And so in an effort to build solidarity as it relates to research among African Americans, we've got to utilize trusted voices within the community to engage them, have a level of transparency in the messages that's relatable, dispel myths that are out there. Public engagement begins, or public health, I should say, begins with public trust. So we've got to establish that. And we have to take the politics out of the message. So in dialoguing with African American communities, that is the underlying theme that we are seeing. And so our role is to actively engage in putting communication efforts out there that are trustworthy, because the message is just as important as the messenger. And so that's what we're finding, to engage more African Americans, not only in conducting research, but in participating in research that is fundamental to gain their trust.
Mm-hmm.
I was gonna Oh, go ahead. Sorry.
That's okay. That, the same thing that Dr. Sandra said that happened with the Hispanics. The Hispanics are not really into research, and we really have to work with it, trust information, and using organizations that really are known in the community. Bringing this information is very impacting because the Latinos will really listen to the people who they know, or people who are already involved in research. And that is very important. That has to be for trusting people that are coming with information. And also, changing that point of view, they was only inviting to be part of the surveys or things, that to get the data, but there was no explanatory information for the Latinos to really make them to engage and understand what is the purpose of the research that we are doing. We have a hard time to really get involved the Latino community in all these research programs. Christine?
Yeah, it's just gonna
So we have, but our mission is slightly different because we're actually generally a funder. But two things that we did since coronavirus began was our relationship with the nonprofits that we fund is so important all the time because we make it our mission to collect data about the community and give that data to the nonprofits so that they can support their clients based on data. But at the same time, data is only data, and having the anecdotal messages and understanding of what each of the nonprofits is facing on a daily basis when they're trying to serve their clients in the community is equally as important. And so we tried to make sure that we were sort of a conduit and facilitator of information for the nonprofits so they could distribute information to their clients, but also to make sure that we were listening to them in responding to the needs of the community because they were developing so fast. Data lags many months and often years in time. And when you're going through an emergency situation, it's really more important to have those community conversations and survey folks, have the nonprofits surveying the folks that they work with and for every day and telling us really how the needs are changing. Because for several months there, they were changing almost on a daily basis. For example, when the schools shut down, the need for the schools to facilitate free lunch and dinner pickup for students and their families was imperative. And that was, something that had to happen really quickly. So that's just an example of, we rely on data, but in a time of emergency, you have to take that data, as the backdrop for what you're hearing from the community.
So I think Dr. Brown raised a critical point and something that was kind of stated in a very profound way, that the community trusts the science, but they don't trust the scientists. So how can we as a community and people, both academic and community, find a way to kind of solve that problem? Because the science is created by the scientists. So there is some missing piece there. So I want us to maybe explore it a little bit. Is it because researchers are not engaged in community and they don't know how to relate to community? Maybe we could kind of touch on that a little bit. Why is it that they might trust the science but not the scientists? So I'll throw that out there and see if anybody wants to take a shot at it.
Well, I think we can't overlook the obvious. There are three pandemics going on right now. We have an economic pandemic, we have a physiologic pandemic from COVID, and we have a sociologic pandemic from racial injustice. And all these three pandemics are coalescing at the same time. And so, in the midst of trying to engage the community in research activities, we cannot turn a blind eye to those three pandemics that are coalescing. Everything begins and ends with social determinants of health. Where people live is so paramount, and where people live should not determine whether they live. And so zip code, you've heard the term that zip code is more important than someone's genetic code. And so I think we have to get to the grassroots level of really, really determining what is happening with the disparities of health, with the inequities that are occurring. And we have to let people know that we care about them. They will be more engaging. They are more concerned with how you make them feel, or wanting to know that you care about them. So that basic level of empathy and humanity, I think, is first and foremost has to be established. And that's been in my dialogue with the African American community. They want to know that you care, not that you're just here for the data, not that they're just a number. And what impact will their participation in the research do for their people? They're willing to participate, but they want to know what benefit is this going to be to the larger society. So I think that those are some first steps, really looking at those health disparities, looking at the social determinants of health. You cannot overlook that to engage African Americans and our brown and Black communities in research.
Anybody else wants to? I'm reminded of a saying that if you don't care, you can't reach them. And if you can't reach them, you can't teach them. So the care factor is important. You have to first feel there's a connection. And then if you can reach them, then you can change things, teach them. So that's very powerful. Any one wants to add to what Dr. Brown has articulated? Well, I also wanted, while I'm thinking about the subject and talking about funding, I'm hoping that maybe we can convince our brothers and sisters in Northern Louisiana to look at a possibility of academic and community partnership in some of these funding mechanisms. We're finding that through CaTS with our Community Scholars Program, even funding people as much as $10,000, where there's a community equal partnership between community and academic, they're gaining a lot of great results and forming lasting relationship, because one may bring the science, the other might bring knowledge of the community, and that seems to be working very well. So maybe we could kind of look at that as a model going forward. So I just throw it out there just as something to think about. So let's look at how has COVID-19 changed the dynamics of your work, and how do you anticipate it impacting the way we understand and respond to future crises? Anybody wants to take that? Go ahead.
One thing that we in the foundation world have learned, and learned this in the past really from hurricanes, is that if you don't have a system in place before the crisis happens, then you're really kind of too late. And so it's so important for us here in Shreveport, Bossier to build a really robust system of community resources, and not only build it, but also make sure that the public and the community understands that it's available. And I think that is always the struggle when you are a nonprofit that is getting your message out to the public of the resources that you can provide. And it's often because nonprofits don't have the capacity or the marketing dollars to do that. And so one thing that we at the Community Foundation try to do is speak, sort of globally for all the nonprofits, and to let the community know that all of these resources are available, oftentimes that are unknown, and making sure that the community, that the nonprofits rather know a lot about each other, so they can have a robust sort of referral system between one another. You know, for example, one of the things that we're working on is trying to lower the number of children that are removed from their homes and into foster care, into the community. And that is a preventative action, not a reactive action. And so in order to do that, we have to make sure that families who are vulnerable know where all of the resources that they need are to be successful, rather than sort of answering that call after it's too late and that family has entered into the juvenile court system. So really prevention and setting up all of those lines of communication ahead of time is key.
Yeah.
In addressing what has changed, 2020 is the year that changed the world. We will never be the same, and we cannot go back to status quo. One of the good things about this crisis, and I try to find the silver lining in all the crises, is that it laid bare all of the health inequities that have existed in our state for decades. And I have to say that I applaud Governor John Bell for appointing a COVID-19 health equity task force. He heard our voices and he took action. It is a pleasure to have yourself, Dr. Sarpong, a member of the task force. We have people in the chat room, Dr. Terry Davis, Dr. Connie Arnold, who are on the call, just to name a few who are here with us. But this is a group of a diverse, distinguished subject matter experts that are volunteering their time and pulling up their sleeves to try to get this right, to try to move that pendulum from 49th ranking just in incremental steps. And so everything has changed. We will never be the same from this COVID. But hopefully our work will speak to the thousands of lives that have been lost to COVID, and that we'll be able to make through our work some differences, for decades to come, particularly as it relates to health disparities and health inequities. I'm a firm believer that, health, good health, it's a birthright. It's not a privilege, that everyone should have the same level or access to the same level of quality care. And hopefully through this, we'll see that moving in that direction.
Yes. Yes. We should really have main changes with the golden change. We used to have classes in groups, and we have to hold this meeting now in open places and with a small group of individuals. So we had a big change, and we know this is a difficult time right now, and we know this already 9 months in this. But we as organization, we are continue doing our presentations and classes, providing to the community, because we had the domestic violence classes and also the Empowering Me class that we have to continue doing via like virtual, like Zoom or WhatsApp. And we have to get adjusted to the new life, because this is a new way how to really live. But that is what we think after this difficult time, we are considered that we are prepared for facing any other similar situations. I think this is helping us to be alert. There can be other situations like pandemic or similar to this, and we know how to take the first step in such a case coming. So like you say, yeah, it's true. This is a big change. We are not going to be the same, but we are preparing how to really be for the future, be teaching and continue doing what we do with the organization.
And,
Okay, so go ahead.
and to Dr. Brown's point, I was just going to add, we the the changes, obviously, COVID-19 did not cause the disparities that we have here. It just highlighted them. And, what we don't want to happen at the foundation is that the great changes that are made are temporary. And so when we look at things like the lack of Wi-Fi or the internet disparity that goes on here for school children, we've been working with the city and the parish and the library system here to figure out how can we make these changes or this access that the children now have permanent, because it ensures that they are able to keep up with their peers who have access to Wi-Fi. And so it's so important, to make sure that those changes have a permanent source of funding, rather than, be just a Band-Aid to be used during this tough time period and then retract that funding.
Yeah,
So go ahead then.
yeah, for example, we have a class for, the life skill classes that we teach to kids. And in this pandemic, we had to do outside in the park, a campus, open campus for the kids, because we had to continue doing what we do, the prevention education classes. And we did, we changed it, we adjusted, but we are continue doing what holding chain is supposed to do in the community. Yes, that's true.
So what is the I'm trying to see how to frame it. What is the wish or the ask of community at this point? I mean, and we could take it anywhere as it relates to COVID, as it relates to the research going on, vaccine uptake, vaccine distribution. So with your ears to the ground, what do you think is a big ask of our community at this moment? I know you're all from different spaces, but from where you sit and from the lens from which you look at COVID, what would you say would be the big ask? So for the Latino community, and maybe the role of HBCUs, our school systems. So I'll leave it generals, because I love creativity. So I want for you to take it any direction that you see fit.
Well, I think the big ask for HBCUs and the African American minority population would be, again, to promote solidarity. We have to be on one accord with our actions, with staying safe, with stopping this spread as best we can. And through those actions, I think we'll realize that as one, we're more resilient than we ever thought. I mean, we've been into this thing for 8+ months, and we want to be through with COVID, but COVID is not done with us. And so as long as it is here, we have got to take those actions and be on one accord. And that's our common theme that we try to promote on our campuses, so that, we can be proactive. As far as the vaccines, it's going to be very, very important that trusted messaging is being delivered, because there's so many myths that we have to dispel. It's been said before, I put my sleeve up to get the shot, I need to know what I'm getting, why I'm getting, and is this going to help me or hurt me? And so, those are the messages that we've got to promote. And then, we've got to learn from best practices from other states. We're not too proud to learn what works. And I think Louisiana needs to position herself in finding out what works better for different populations, different communities, and employ those best practices here.
Thank you. Anybody else wants to go next?
I would say, we have a kind of different perspective because of what we do. And, I've got a couple of asks of the community. My one is that, you know, of course, donors who are able to continue to support nonprofit work, continue to do it. And there are a lot of tax incentives out of the CARES Act that incentivize donors to make contributions by year end. But to the nonprofits of the community, and, you know, to the folks that make decisions at the city and parish level, dollars are scarce, and collaborating to make sure that you're being as efficient and effective with the dollars that have been allocated to you is so important from our perspective. You know, and the dollars are scarce, and they continue to get more scarce. And so we really, really have to be mindful of how we're spending grant dollars, just to make sure that they go as far as they possibly can, and really help those in the community that are in need.
Yeah, that living in this normality is the most of the cases. It has been difficult to adapt to it because the changes that we are making. But I feel satisfied that the most information now in Spanish for the Hispanic community, and this is going to help them to be informed and have, you know, to be in their own language, and also coming from the organizations. Trusted organization will help them to continue supporting organizations like Golden Change. If we want to continue with our representation in the community and offer the program and support the other groups that they are, you know, suffering this adaptation or these changes that have been. Like we say, you know, we have to avoid the 3C that we always say, like space, closet, no closet space, no crowding, and no close contact. That is a good thing that we have with the Latinos. And I really have hope that this is going to be a good beginning for the Latino community to get involved right now and collaborate with all these resource programs that are available.
So like they say, all good things must come to an end, and we're almost close to the end of the program. Sadly to say, because I've learned a lot and I'm really enjoying the conversation that's going on. But we want you to leave us with a word or two, or a sentence or two that should be our take-home message on the topic, and how we as a state, as a community, are dealing with COVID-19. So I'll let each and every one of you give us some nuggets of wisdom to send us off this evening, so that as we reflect on the conversation this evening, those words or nuggets of wisdom will resonate with us.
Well, I'll just end on a note that this is a movement and not a moment. And we have to take advantage of this movement. As Kristina said, COVID did not cause the health disparities. It just exposed it. And so this is an opportunity for us to do some great work for the citizens of Louisiana. The bright light has been shining on us. We were one of the first states to reveal our data as it related to those health disparity numbers. And ever since that day, we have been faithfully watching the numbers, making sure that our citizens are safe. And so we've got to use this crisis to make a difference. And I firmly believe that we can do that. We can pull together for our beloved state and make it a healthier state.
Okay. Who wants to go next?
I would just say I was so impressed with all of our local nonprofits' ability to really change the way their services are delivered overnight. You know, they all kept working, didn't close their doors. and adjusted really, really quickly so that they can make sure that they served, the folks in our community that are in need. And I was really impressed with the generosity of our community in responding to, us asking for funding for COVID-19 emergency grants, as well as we have a 24-hour giving day here. It was the largest day that we've ever had. We collected almost $2 million in 24 hours for all the nonprofits here in the community. And it was done entirely online. And so I've just been so impressed with the generosity of the community and how quickly and efficiently the nonprofits have handled, the change in their delivery model.
Yes. Well, as a message, I always say this is, it's a time, a very difficult time, but we can be the change that we want to see in the world. We are the ones who has to learn and get education in all this COVID-19. Know that this is a time that we will pass, and this is going to be like experience to be better. And I think that is my message is for the community to continue get educated in what is offering, especially in our own language, in Spanish. I am very proud that Golden Chain is involved and collaborated with so many organizations that really offer the service and information in Spanish to our community.
Okay, thank you. And to those participants, I want you to join me to thank our great panelists for a wonderful discussion on the topic of community and research engagement as it relates to COVID-19. I personally want to thank all of you for bringing the insights. It's really been a wonderful evening of discussion. I think you left us with a lot of important things to reflect on and to think about. The recording of today's session will be available in about a day or two. If you're on the CaTS listserv, you're going to receive information pertaining to that, and also we would have it on YouTube. Our next seminar would be on Thursday, December 17th, same time, 4 p.m. And this is actually, we're looking forward to your participation in the future ones to come. The next one is the two individuals who are going to be featured are Drs. Coles and Dr. Fosco, both from Tulane School of Medicine. And so lastly, I just want to share with you all that COVID-19 has sort of disrupted a lot of things for us, but it's almost like the tale of two cities. It's the best of times and it's the worst of times. It's the worst of times because of the disruptiveness of it, but it's also the best of times for us to take a pause and reassess where we are as a community, as a people, as a state, and to look at addressing the needs of humanity. As Dr. Brown said, health should be a birthright, not a privilege. But I just want to leave you with this little story. There was a community where this old man was considered to be the wisest person in that community. But a group of young kids thought that, well, he can't be the smartest person. He's not the wisest man. We'll put him to a test. So they came up with this game plan of going to the forest, catch a bird, and they were going to walk up into the hills where he lived. And they were going to ask him whether the bird they had in hand was alive or dead. So when they got up there and they looked at the old man and they said to him, "Old man, we hear you're the wisest man in this community, but we have a dilemma." And their trick was that if he told them that the bird was dead, they would leave it and it would fly away. If he said it was alive, they would choke it and kill it. So either way, they were going to show that he wasn't the wisest man. So when they presented the situation to him, he looked at each of them in their eyes and he paused for a moment, reflected, and then he said to them, he says, whether this bird lives or die is in your hands. So how we deal with COVID, whether we get rid of it, whether we improve the lives of the citizens of Louisiana, is in each of us, our hands. Good night. It was wonderful being with you this evening. Have a blessed evening and stay tuned for the next seminar series. See you next time. Thank you. Good night.
Thank you.
Thank you so much, everyone.
Thank you.
Bye-bye.
Wow. Thanks.
Thank you. Take care.